last but not the least, because he's going to talk about one of the very important part of the brain, and that is the limbic system. So Sir specializes in magnetic resonance imaging, MRI, and especially neurology. So all those students who are interested in that and the limbic system, stay awake. Okay.
मायनसच करून टाका नाही ते.
Good afternoon, everyone. I am Dr. Vivek Mere, Assistant Professor in the Department of Anatomy. I would like to introduce you to our next speaker, and this is the last session of our today's webinar. Dr. Rahul Vakharia sir is currently working as Senior Consultant Radiologist at Sir H.N. Reliance Hospital, Mumbai. Sir has 25 plus years experience in the field. He is interested especially in neuroradiology. He has multiple publications, national and international, in his name. Also, sir has done short fellowship at Sickkids Hospital, Toronto, Canada. Today, sir is going to enlighten us regarding the magnetic resonance of the neuroanatomy of hippocampus and the limbic system. Please give a warm welcome to Dr. Rahul Vakharia.
Thank you. Good afternoon, everybody. And after a very good lecture from of the heart, we'll move to the brain, which gives the order to for people to function, right? So, sorry, at 3 p.m. taking a lecture on anatomy of hippocampus and limbic system is going to be a little toxic. Please do not slip off. I'll try to make it as simple as possible, right? So start off. Hippocampus and limbic system, they are part of the temporal lobe. And to understand the anatomy, we need to basically understand first the function, what it does, and then we'll go to the little bit of anatomy of the temporal lobe proper, and then go dedicatedly to the hippocampus and the limbic system. So the temporal lobe plays a very key role in our cognitive functions, basically like creation, retrieval and consolidation of the memories, special navigations, as how you go from Nair to your house, or how do you go to from Nair to Maratha Mandir and whatever. Emotions and social behavior, how do you behave in the class, how do you behave on the road, how do you behave in the society. So temporal lobe, the hippocampus and the limbic system plays a very important role in doing this. So now coming to the brief about what is temporal lobe. So the temporal lobe is divided by 5 cell size. Basically there are 3, 2 on the lateral, 2 on the inferior, 1 on the middle side. The temporal surface, it 4 cell size, and it divides the, I'll show you the images also. Let me show you the look at it. Okay, so you can see from this image that this is the Sylvian fissure what you are seeing here. this is a gross anatomy, then we will go into the MR anatomy. This is a sylvian fissure here, which, and this is the superior temporal or the first temporal sulci. Between these two is a superior temporal gyrus, right? Between the first and the second temporal sulci, there is a middle temporal gyrus, and below it will be the inferior temporal gyrus. The superior temporal gyrus continues posteriorly into supramarginal gyrus, which is this. You can see the white arrow. It continues like this here. The middle temporal gyrus continues behind with the angular gyrus, and the inferior temporal gyrus continues behind in an inferior occipital gyrus. This is on the lateral surface. Now coming on to the inferior surface, there is a fourth convolution called occipito-temporal gyrus, and there is a small collateral fissure. Okay. This gyrus is called temporo-occipital gyrus, and this is called a lingual lobule, which the parahippocampal gyrus continues behind. So this is a written part of it. Now this is the MRI, how it looks. For the temporal lobe anatomy, we usually perform a MRI in an oblique coronal plane perpendicular to the parahippocampal and the parahippocampal gyrus. So coming to this is the first superficial temporal gyrus. This is the middle temporal gyrus. This is the inferior temporal gyrus. You can see this arrow. This arrow is collateral sulcus. This is the temporo-occipital or subcollateral gyrus, and the second arrow, white arrow, what we have been labeled is parahippocampal gyrus. Okay, so the parahippocampal gyrus is laterally cut short by collateral sulcus or margin by a collateral sulcus, and on the left hand side, if you can see here, the thing which is highlighted in the pink color is the hippocampus and the parahippocampal gyrus. Medial to that will be an ambient system. Okay. So this was what we have seen, the lateral and the inferior surfaces of the temporal lobe. Now coming to a more important medial or mesial temporal lobe, which is the more or less the primary site or the high chances of lesions which are causing epilepsy in humans. 70% of the epilepsies they arise from the temporal lobe. So to understand and once we know the anatomy, it will be easier for us to come to image the image on MRI and pick up the pathology. So mesial temporal lobe is a part of the limbic system. So I will start off with that. The first will be the parahippocampal gyrus, second will be the uncus, third will be the hippocampus, fourth will be the fibria, dentate gyrus and amygdala. These are the part of mesial temporal lobe, which basically is, and indirectly they are part of the limbic system. So what is parahippocampal gyrus? So parahippocampal gyrus is a gyrus which occupies a space between the inferior and the medial surfaces of the temporal lobe, and it extends longitudinally along the tentorial leaflet. So I'll show you on the images also. So it's along the tentorium and it makes contact with the ambient system as what I just showed you. This is the ambient system. So you can appreciate this is the parahippocampal gyrus and this is the ambient system. Okay, so anteriorly at the anteriormost end it turns medially and posteriorly, which forms the uncus, and this uncus has a very important component which is called entorhinal cortex. The parahippocampal gyrus itself, as this is the anterior aspect. Now coming to the posterior aspect, the calcarine fissure divides the parahippocampal gyrus into a superior component and an inferior component. So let me show you image. Okay, you can see this. This is the green, the parahippocampal gyrus. This is the lateral aspect. is divided into two parts. The superior, which continues with the isthmus, goes above and connects with the cingulate gyrus. This cingulate gyrus will go loop around the corpus callosum, comes into the subset in the septal area and ends here. Okay, this area is called septal area, and then the inferior portion will continue as the lingual gyrus of the occipital lobe. Okay. This lower. Laterally, it is liberated by the collateral sulcus, what you can see on a coronal plane. Okay. This is how it looks on MR. You can see this parahippocampal gyrus out here, marked by a blue arrow. This is the MRI T2 weighted imaging. I'll come on T1 and T2 little later once when I show you the proper. These are the static images. I'll show you the dynamic DICOM images also for this. Okay. So the parahippocampal gyrus, it has two components, very important two components. One is subiculum and one is the entorhinal area. The subiculum is the medial and the superior edge of the parahippocampal gyrus, and it connects to the corneo-ammonis or an ammon horns. Okay, and entorhinal area, or what we call is Brodmann's area 28. It's not a well demarcated. You can say that this is entorhinal cortex, but it's a diffuse area which it's located in the uncus. I'll show you on the little later on the images. So the next part of the limbic part would be the uncus part. The uncus is formed by the anteriormost part of the hippocampus, and it is functionally divided into two parts. The anterior part belongs to the parahippocampal gyrus, and the posterior belongs to the hippocampus proper. Okay, so now I was just telling you about the subiculum. So this is the hippocampus. This is, if you can see, this is the temporal horn. This is in the coronal plane. We are cutting the plane in a coronal plane. This is the parahippocampal gyrus, and it turns like this laterally. The first part what you hit would be a subiculum. Okay, subiculum will continue with corneo-ammonis, which is 1, 2, 3, 4, and then down below would be a dentate, gyrus dentate. Okay, a small thin line what you are seeing out here is called alveus with a fibria which is thickens medially and forms a fibria. Coming to the next part of it is the hippocampus. So the cerebral cortex is usually made of 6 cell layers, neocortex, while the medial temporal structures are formed of primitive allocortex, which can be, depending upon the area, can be 3, 4, or 5 cell layers. It begins in early life as a flat plate-like structure along the medial wall of the floor of the temporal horn, with the hippocampal infolding, which results into characteristic interlocking C-shaped two interlocking configurations. Okay, so the hippocampus itself is arbitrarily divided into three parts: the head, body, and the tail. Talking about the head would be the head itself. It's the most anterior part of the hippocampus, and it is the most voluminous. The body and tail are not that big, but the head is more voluminous, and it's further divided into the intraventricular component and the extraventricular component. The extraventricular component is nothing but the uncus. The intraventricular component is what we see those digitations on MRI or on the images. Those are called intraventricular. They are called sulci, small sulci, divided by sulci, and this is believed that it came about as a result of obstacle to the forward development of the hippocampus. Okay, a good number of people, the head of the hippocampus would be fused with amygdala. The hippocampal body again is divided into two divisions, like the intraventricular and extraventricular component. The intraventricular part corresponds to the depth of the C1, CA1 and CA2 field of abnormal, and extraventricular part is the medial surface and is made up of dentate gyri,